Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss a quite extraordinary tweet from the Health Secretary Steve Barclay, in which he is either drunk or trying to have a competition with his Prime Minister for who is the most out of touch. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So I had my attention drawn to a tweet, supposedly from the Health Secretary, Steve Barclay. Now, don't worry, this one is actually a spoof. But when I tried to look through his actual tweet, I looked at it, I thought, not sure about that. I looked through his tweets and I saw something just as ridiculous. So this tweet that I saw was a clipped image. So straight away you're thinking, oh, it could be doctored. And it supposedly had Barclay marvelling at this wonderful new innovation for moving patients between the floors of hospitals called a lift. The tweet wasn't real, and for the avoidance of doubt, the Twitter handle referred to in the tweet, which will draw your attention anyway, does not actually exist, of course. But, just to be absolutely sure, because what can appear to be an obvious spoof these days can sometimes turn out to be real. I mean, would you believe that the Prime Minister, a former banker, doesn't know how to use a credit card to pay for goods? Or that the same Prime Minister would ask a homeless man if he works in business? Would you believe that the guy who began last year as Prime Minister would get a donor to pay £27,000 a year for takeaway meals? This is why spoof can either fall flat or be far too readily believed these days. The truth is often stranger than fiction. But I go to his actual Twitter account and I can't find that one, of course. And I look at that Twitter handle and think, I thought, yeah, that's not real. But you can imagine it, can't you? You can imagine the Health Secretary going around and going, oh, what's that thing? What is that? Oh, it's for moving patients between floors, Minister. Well, it's marvellous. I thought you used to just chuck them down the stairs on the trolley. But this one's actually real. Maybe it's what inspired whoever came up with the fake tweet. He speaks about paying a visit to a hospital and being impressed with the discharge lounge. And he put discharge lounge in quotation marks as if it's like, oh, the people won't actually know what it is. It's like, oh, it's technical term. No one will have ever heard of it. He marvelled at how this concept of letting patients who are ready to leave hospital but not quite discharged yet can sit in a chair to allow the NHS to free up hospital beds and reduce waits. I'm sorry, but if you were to put this tweet, the one thinking that using a lift to move patients between hospital floors is innovative, and one, that sort of goes, cheers, brilliant, and you tell me one of them's fake, and I'd look at them and go, they're both fake, surely, mate. You tell me one of them's fake and one of them's real, I'd have to guess. Is he drunk? Is he off his head? First of all, that tosh about the NHS being under pressure due to a surge in COVID and flu cases. No, the NHS was under pressure this summer without those surges, having to declare critical states of emergencies at times. That was summer. This winter, it's falling apart. But yeah, politics, of course, politics. Of course, the government is going to put a spin on things that minimises the desperate state of the NHS that they are presiding over and makes it look like they're doing something useful. But this is pathetic, even by the standards of spin politics. I mean, the reason why, of all public services, the NHS has such a special place in the public's heart is that we all need it from time to time. You could say the same thing about schools, but a lot of people don't like going to school. But the NHS makes you better. Even the fittest, healthiest person needed it to at least be born in, but many people will need its services as adults as well. We know that people don't occupy beds when they don't need them. We understand that when you're well again, but before you actually leave the building, you will be moved to an area where you can sit on a chair. We understand what a chair is, that hospitals use them to allow people to be comfortable when they're waiting around. And whether that's waiting for an appointment, visiting someone who does need the bed, or waiting to be discharged once you're well enough to vacate the bed you were in. It's not special. It's obvious. It's nothing new. It's a concept that's been around as long as the NHS. It doesn't free up beds and reduce long waits because nobody in their right mind would put someone in a hospital bed when they didn't need it, when they could use a chair. Right now, people are looking to the government for answers to the problems they created. Rishi Sunak gave a New Year's speech in which he promised to fix the various things that his party and government had broken, but without actually saying how he was going to do it. You know, the way I characterise this is, I'm going to fix these things that my party and government over the last 13 years has systematically broken. What's that? What's my plan for doing it? Oh, I don't have a plan, but I'm totally going to do it this time. In contrast, Keir Starmer explained how he was going to tackle the knackered country that the Tories were leaving him. And vague promises about growing the economy and reducing inflation, they're not going to cut it without a plan and without action. I mean, the public remember what happened the last time a Prime Minister promised to grow the economy. She lost 30 billion quid, which Sunak's government somehow turned into a £55 billion worth of tax rises and public spending cuts. And at winter time, with another Tory NHS winter crisis of the sort that just didn't exist once Labour had been in power for a few years, the public want the government to say what they're going to do to fix the problems that they can readily see. What they don't want is for a health secretary to wander around a hospital. He finally actually visited a hospital, marvelling at chairs, at systems that have been in existence for nearly 75 years, saying how great they were as if it's something that's been in place since before he was born is somehow thanks to his good work. People want to know what he, Stephen Barclay, the health secretary, is going to do to make things better. But of course he can't tweet anything like that because he's not actually going to do anything. In fact, he's going to make things even worse. You know, the government talk about, we're going to cut budgets, we're going to ring fence funding for the NHS. But that's a lie. They're already reducing the real terms funding with the pay cuts for staff. And don't forget, it's still their intention to raise fuel duty next spring. I mean, I still struggle to believe they'll go ahead with that, but that is currently their stated intention. And if they do, don't imagine they're going to provide extra funds to cover the extra cost of fuel for ambulances. No, that'll be more healthcare cuts made to cope. Suppose it shouldn't really be a surprise that a government led by a man who doesn't know how to pay for petrol at a service station would be so out of touch as to think that a group of chairs was the latest medical innovation. But it's still depressing to see it. I mean, I just picture this health secretary going around the hospital, seeing some patients in chairs. What are they doing there? They're waiting to be discharged, Minister. Aren't they in a bed? Well, they don't need a bed. We use the beds for people that need it. These are on a chair. Oh, it's marvellous, marvellous. Well done, keep up the good work. You know, I've said it before, on a distressingly frequent basis, but we just do not have a serious government these days. You know, this tweet, just like this government, so badly out of touch that it's too dangerous to allow them another 2 years in power. But of course, unless the Tories implode, that is what they're going to get. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.